Good evening. It's the day symbolised by a simple green ribbon with the aim of tackling the continued stigma surrounding mental health. Today marks World Mental Health Day with a focus on suicide prevention, and the figures here in Scotland are stark. Last year, the number of suicides rose by 15% to 784. Particularly alarming is the spike in deaths amongst young people, especially young men. In 2018, the suicide rate amongst those aged 15 to 24 rose by 50% in just 1 year. So what needs to be done and how can we do it? Well, Louise Hosey has been hearing one mother's heartbreaking story of how her teenage son took his own life.
He was mischievous. He was cheeky without a doubt. His passion was his drums. He loved his skiing. He was happy, he was vivacious, energetic, and I mean, it was just when he came into adulthood really that he started having problems.
It's been 1 year since Tom Smith died. He was 19. His mum Alison thinks about him every day.
We tried so hard to get him the right kind of help. So whenever we would try and phone to get help, we were told, well, we can't, it has to be Tom that calls us. I just thought common sense should prevail on these occasions, especially when it's related to mental health.
After a happy childhood in Aberdeen, Tom went to study in Glasgow. But one evening he was badly assaulted during a night out with friends. He came back to Aberdeen but became increasingly isolated and withdrawn. Eventually, he was admitted to hospital.
I asked him if I could get in touch with some of his friends, but Tom said no, because I think he felt ashamed of where he was, what he was going through.
As Tom's condition deteriorated, his family became unhappy with the care he was receiving in hospital. He returned home.
The night before he did what he did, he sat on the sofa with me and he put his head into my lap and I stroked his hair, and it was the first time I'd done that, and I went, "Oh, Tom," says, "we haven't done this for years." And he just says, "I'm so sorry, Mum." And I went, "You've got nothing to be sorry for, Tom." And then the next day he did what he did, but
Tom's family are now calling for more support and funding for those who are struggling. It's a view shared by mental health organisations.
In 2018 alone, just in that year, we had, during Mental Health Week in May, we had 800 plus calls to our information line. We had our own staff in tears because the demand was so high, and people were hugely upset because we had to tell them that we didn't have anything like that in appointments to give away.
Alison says she hopes telling Tom's story will encourage a culture change, particularly amongst young men and boys.
They need to know it's okay to speak. They need to know it's okay to reach out. They need to know it's okay to be vulnerable. If somebody's acting differently, they need to recognise that person, don't be afraid to ask them if they want help.
There's not a minute of a day goes by where I'm not thinking about Tom. And it's just very, very sad and very tragic. I wished he'd been able to talk more.
Louise Hosey, STV News.
And if you'd like to know more about the issues raised in Louise's report, you can find details of mental health support organisations on our website.